What's up, guys? I'm here and I'm going to show you 3 posterior instability tests for the shoulder. I'm going to show you the posterior slide at 90, the jerk test, and the posterior slide at 0. So we got a lot to do, so let's get going. Alright, so first, like I said, we're going to do the posterior slide at 90. You're going to want to have your patient sitting or supine, bring their shoulder into 90 degrees of shoulder flexion, 90 degrees of elbow flexion. So what you're going to want to do with your hand is make a Spock sign. You're going to want the joint line to be right in between your fingers there. 2 of your fingers will be on the glenoid. 2 of your fingers will be on the head of the humerus. That is just going to help you feel if there is any translation, subluxation of the shoulder. And then what you're going to want to do with your other hand is provide a posterior force right through that head of the humerus. So go ahead and do that. Okay, here you're looking for positive signs of pain, apprehension, any subluxation or extra translation in the posterior part of their shoulder there. Then you can move right into the jerk test, continue to provide that posterior force, and then you're just going to horizontally abduct them, or adduct them all the way across their body, and then you're going to let it go and let it come back to the starting position. Here, while you are providing that force and adducting them, you are going to look for a jerk, and that is going to be the head of the humerus subluxing off of the labrum and glenoid going backwards. And then when you let it go, you should feel it jerk back into place too. Finally, we will do the posterior slide at 0 degrees. So you can bring their shoulder out to 90 degrees of abduction, and then you can just place their hand here in your axilla, and you can just hold it there. Again, Spock sign on the back, and then you are just going to provide a posterior force, once again, right on that humeral head. This, again, is looking for any pain, apprehension, subluxation, or instability.